people on holiday this week. So it's good morning. It's the 7th of August on Friday, hottest day of the year. So I hope everyone is keeping well. So today I want to just give you a couple of quick updates before I talk about flu, which is what I'm going to mainly talk about this morning. Just to get you to know that we'll soon get advice through the EPS type on EMIS to say that when a patient goes into the pharmacy and they give them an emergency supply of medication, there will be a functionality added to EMIS that will get alerted that that patient has been given an emergency prescription, and it'll kind of auto order it so they don't have to go to us and explain what's happened. The next thing is you probably received something in the bulletin last week about asking you to let the CCG know about the current issues being faced by us in primary care. And this is really about the sort of as people have called it, the transfer of work from secondary care back into primary care. And examples have been, can you organise this blood test and let's have the results? Can you do this and can you do that? So there's something come out from NCL asking you to fill in a quick form, a data collection form. It's not asking you to give any patient data or any kind of detailed information. It's literally asking for numbers to say, on a typical day or week, how many of these type of requests would you have received, and could you quantify them into what type of request they are? So is it a blood test request? So it shouldn't take you more than a couple of minutes to fill out, and you should have received that in last week's bulletin. I think there'll be a reminder in this week's bulletin, and then it's asking you to email that to the NCL CCG quality team so they can take that up with actual numbers to the all free. The next thing I wanted to let you know about was audiology, and community audiology has restarted and is contacting patients pre-COVID already. Earwax removal via microsuction is due to restart on the 17th of August. Obviously, they won't be seeing anyone who's had a perforated eardrum currently because there's a risk of aerosol generation there. And they'll be restarting and contacting pre-COVID patients as well. And then also heads up that domiciliary audiology is due to restart around the 17th of August as well. And again, we'll be contacting patients pre-COVID, so there's a small backlog there. I would expect new referral waits to be around 6 to 8 weeks, where they previously were 4 weeks pre-COVID. And that's because there's a built-up backlog, but obviously this is just an estimate at the moment. And in the next 2 weeks, we'll be able to sort of define whether it's a longer or shorter backlog, depending on sort of the numbers of referrals that start coming through and the amount of backlog that they get cleared. Just like us, it takes longer to see a patient because of infection control and things like that. So the big update I want to talk about this morning, and it's not really an update, it's really a discussion about flu. So as you all know, we received a letter on the 5th of August, which is the second annual flu letter, giving us more details about this year's expanded flu programme. And as you know, they're being asked to vaccinate more people in different cohorts. So what they've said is household contacts of those on the NHS shielded patient list, and specifically individuals who expect to share living accommodation with a shielded person on most days over the winter and would come into close contact would also be eligible. Children of school year age 7, so those are generally aged 11 years old, on the 31st of August this year. Health and social care workers employed through direct payment and or personal health budgets, such as personal assistance to delivery, domiciliary care givers as well, those kind of people as well. So I'm just going to share my screen so you can see a slide that I want to bring up. So I'm just going to get that on the screen now, because I think it's a really important slide for you to be able to see. So I'm just going to bring that up now for you. So hopefully you can see that now. And really what I wanted to show you was this slide here. And this slide, I'll share this with you as well. So it's talking about existing cohorts, new flu cohorts, and what it means for contractual changes and stock. So what we're being told by NHS England is that we are being told that the 50 to 64-year-olds should be vaccinated in November and December, subject to vaccine supply. And what they've actually told the CCGs is that they will provide at least 50% of the jabs for that age range. And they've apparently bought stock for us. So I really hope that's true. I don't know at the moment how that's going to come into our practices logistically, but I know there's plenty of time for that to be worked out. So what they announced is that we should continue vaccinating, children, over 65, pregnant women, all the usual people that we vaccinate, including our staff. And then in November and December, subject to sort of supply of stock, we will be asked to vaccinate 50 to 64-year-olds. Now, this is a public health issue, not a general practice issue. I think we need to wait for more guidance to see what we're expecting, what the numbers we're expecting to do, how we're going to get supported in primary care, because we are a primary care giver, not a public health giver. So it'll be interesting to know, but I know that we all want to do our part and vaccinate our patients. So it'll be interesting to see what comes of the next few weeks. I wanted to then talk about what does that mean for us in primary care? Now, we've all had different ideas of what we can do. Now, there are some CQC guidance that I really need to make you aware about, because there's different ways of providing flu jabs this year. So you might decide to do it in your practice or a branch practice if you've got one. And actually, you don't need to do anything different. You don't need to apply as we've been doing for years. We're responsible for the quality and safety of that service because it's a CQC registered premises. However, let's say that we decide to deliver the vaccination with another provider, well then actually, and we're going to their site. Well, the site hosted at another location, not listed as our CQC registration, really the other provider is the host for the vaccine service, so they're responsible for making sure that that site is adequate, and that host is registered to carry on regulated activity with the CQC. So the other option might be that we work with lots of different providers, or we ask other providers to provide vaccines, which I doubt is going to be something that we're going to do. But again, it'll be their responsibility for the premises, and we won't need to do any applications. Now, one of the things that the next option is actually something we might decide to do. We might ourselves provide the vaccination at another medical site. So we might be just using that site. So this premises is not usually used by us, or never been used by us for vaccination. We are then responsible for carrying on the regulated activity, the quality and the service at that site. But we do need to apply to the CQC to vary the location condition and adding that location to the registration. So if I decided to go to a different medical car park or facility, we need to apply to the CQC. The next example is an exact example of a car park. So a premises which has not been used at all. So if I said to Tesco's, can I borrow your car park? That's not even a medical centre. That's a really different thing. So again, the CQC have said we're fully responsible, but we don't need to vary our registration, but we need to update the statement of purpose to tell us why we're going to be running the vaccination at a satellite site. We need to let the CQC know. We also need to identify to the CQC the lead practice responsible for the regulated activity and the lead person responsible in the practice. And if we're going to use Tesco's car park, for example, as a PCN, are we saying to the CQC all practices share the responsibility, or does one practice share the responsibility? And the CQC have asked for an updated statement of purpose to tell them that they're running the vaccine at a satellite site of their own practice. So there's some CQC guidance on their website really in line with the updates for this year, which I think are quite important for us to be aware of. The next thing, I'm going to show you my screen again, just to show you some sort of modelling that we can talk about in terms of what are the advantages and disadvantages really of doing different ways of jabbing. If we look at, I'm going to come down to this box here, really about considerations for practice to maintain infection control. So really, if we're doing it in, this is the practice setup, the staff procedures, and I can share this with you afterwards. And then here I've got a table about the different modes of delivery of the flu jabs. So whether you did an indoor model or an outdoor model, what are the benefits and the limitations? So for example, Have you thought about a cold chain if you're going to do it outdoors? Have you thought about what PPE is? So, for example, we're suggesting, or there's suggestions that one face mask and visor might be adequate for a session rather than per patient, but gloves might need to be replaced per patient, for example. So there's some discussions here in these tables that I'll share with you at the end of this webinar, and you can have a look at what I think really are the benefits and the limitations for us to be able to deliver this. I think ultimately the reason why I've talked about this morning is that we want to probably maximise what we can do to give flu to our patients, because we're contracted, but also it's a financial benefit for us as primary care. So what we want to do is make sure we're protecting ourselves in primary care to deliver and maximise potential in primary care, because really the thought is that if we don't do it, somebody else will do it for us. So we probably need to really be thinking in advance about what we can do to protect primary care and make sure we're delivering these flu jabs. So I'll share these links with you later on. I'll bring them back up in a week to 10 days time, so we can have another discussion, and hopefully I'll have some more information from NHS England and CCG about the additional vaccines that they're hoping to provide for us. I've gone over a bit. I'm going to stop there for any questions. What about using your own car park tower? Yeah, absolutely, that's fine. As long as you're on your own premises, you don't need to apply for any additional CQC registration if it's your own car park as part of your premises. Any questions from anybody else? I just need to give you a heads up that next week on Tuesday and Friday there won't be any webinar from me. I'm on annual leave, so I'll be back on Tuesday the 18th of August, and on that day I'll be talking to you again about flus, and we'll have some more updates for you hopefully by then. If I don't see you between now and then, have a great day. It's gonna be really hot today, and I'll see everyone in about 10 days time. And between now and then, if you think of anything, just pop it in the chat bar and I'll pick it up when I come back from leave. And if there's anything urgent, just drop me an email. Otherwise, I'll see everyone in 10 days time. Thanks everyone, have a good weekend.
Thanks, Nick.